I have worked in emergency rooms for more than 30 years, and there is a truth I have seen repeat itself over and over again. If you are over 60 and you suffer a heart attack while you're alone, your chances of not surviving rise dramatically. This is not an exaggeration. It is a clinical reality. Nearly 50% of heart attack deaths occur before the patient even reaches the hospital. And it's not due to a lack of access to medical services, but rather something far more common: not knowing what to do. People hesitate, downplay their symptoms, or wait hoping that it will go away. That delay, that extra minute, can be the difference between living and dying. That's why I want to speak to you the same way I would speak to any patient sitting in front of me, directly, clearly, and with the purpose of helping you save your life or the life of someone you love. Today I'm going to share 7 concrete steps, supported by medical evidence, that can double your chances of surviving a heart attack if you experience one while alone. These are not theories or miracle cures. They are practical actions, taught by cardiologists and backed by clinical research that have saved thousands of lives. And pay close attention, because what I will explain in Step 3 can be decisive. If you begin to feel chest pressure, shortness of breath, cold sweat, dizziness, or a sudden sense of anxiety, the first thing you must do, and the most important, is to call for help immediately. Do not try to convince yourself that it's just indigestion or stress. Pick up the phone and call your country's emergency number. Every minute without medical attention means more heart tissue is lost. And as specialists say, time is muscle. After making that call, if you have access to it and you have no medical contraindications or allergies, chew, do not swallow whole, a 325 milligram tablet of acetyl salicylic acid, the active ingredient in aspirin. Not every type works. It must be a non-enteric-coated aspirin, preferably generic, like the ones sold in emergency use formulations. Do not use pain relievers such as ibuprofen or acetaminophen. They do not provide the same antithrombotic effect. When you chew the aspirin, the active ingredient enters your bloodstream more quickly and can help prevent the blood clot blocking the artery from growing larger. Medically, this can reduce the risk of death by up to 23%. From this point on, your goal is to stabilize yourself until help arrives. Loosen any tight clothing, belt, collar, bra, waistband, and find a position that allows you to breathe as comfortably as possible. The best option is to sit upright with your back supported, without leaning forward or lying completely flat. This posture helps reduce respiratory strain and improves lung efficiency, which is crucial when the heart is compromised. If at any moment you feel you're about to faint, start coughing forcefully and repeatedly. This is not a cure, but it may help maintain blood flow to the brain while your heart rhythm is unstable. Medical literature has documented this maneuver as potentially useful in situations of impending circulatory collapse, sometimes referred to as cough resuscitation. Also, make sure paramedics can reach you without obstacles. Leave the main door unlocked and keep your phone close, ideally on speaker mode so you can follow instructions while staying still. Many patients lose critical minutes because rescuers cannot enter, or because the phone is left in another room. Breathe slowly. I know it's hard when panic sets in, but that is exactly when you need to reduce the oxygen demand on your heart. Inhale deeply through your nose for 4 seconds, hold the air for 2 seconds, and exhale gently through your mouth for 6 seconds. This technique activates the parasympathetic nervous system, helping decrease your heart rate and stabilize your blood pressure. And most importantly, do not try to move, walk, or push through it. Every step you take during a heart attack multiplies the workload on your heart. Remaining still, calm, and focused on your breathing may be what keeps you alive until professionals arrive. These 7 steps are not optional. They are evidence-based emergency measures that can be the difference between walking out of the hospital or not making it there at all. Do not leave this to chance. Do you keep aspirin at home? Do you know where your phone is if this happened to you in the middle of the night? Do you live alone? Create a plan. If this content was helpful to you, share it with someone whose life it might save. Subscribe, because on this channel we talk about real prevention, grounded in medicine, not myths. And above all, remember what the Bible says: "My people perish for lack of knowledge." Join us in our next video, where we talk about 5 mistakes you make when eating bananas and how they're harming your health.